I'm Vaughn Biggs, and this is a big LGBTQ story today. Let's queer up healthcare. The feds ease organ transplant rules for donors of HIV recipients. The U.S. Department of Health and Human Services has removed research and institutional review board requirements for kidney and liver transplants between HIV-positive donors and recipients, aiming to boost access to life-saving organs. The updated rule follows the HIV Organ Policy Equity Act of 2013, which allows organ donations exclusively between HIV-positive individuals. To date, over 517 HOPE Act kidney and liver transplants have been performed successfully. Meanwhile, the NIH seeks public feedback on revising research criteria for other organ transplants under the HOPE Act. Comments are due by December 12th. This is a great opportunity. I've had friends not living with HIV, but have gone through organ transplants. And some of that, the waiting period and the paperwork that they have to go through. And by them removing some of this is obviously going to be a great benefit and access to healthcare sooner. I'm concerned always still though with HIV being an inflammatory disease.
Right.
Getting an organ transplant and going through that with the anti-rejection drugs, it just helps. I'm very concerned with how that happens, but I'm so glad if it improves the quality of life. Fantastic.
I mean, the removal of IRB approval is, as someone who went through a PhD myself, it's huge. It's a step that removes tons of bureaucracy and paperwork. And also, there's an acute donor organ shortage in this country. There are people who have been waiting for years to just get a transplant.
Just to get on the list, right.
Waiting in God's waiting room just to get a life-saving procedure. We cannot just abandon these people. I am actually all for a policy like mandatory organ retrieval. If you're healthy and you're dead, what are you doing with it?
Those are very complicated policies.
I know.
Because of a whole host of issues of how
religion, ethics.
The bigger issue is how hospitals treat potential organ donors versus non-potential organ donors for resuscitation issues. There's a whole complicated thing with that. But this is one of those positive stories of when you look at making it a little bit easier for someone living with HIV, because this is one of those really hard medical issues. I do not know much about it. I just know that too often we as the queer community have a lot of questions and concerns for how the medical community does things, especially after when I heard this story, the first thing that came into my mind, which is very unrelated, was blood transfusions, and how I remember being told, we don't know. The gays might have an undetectable, no symptom thing, and I'm like, what are you talking about? You can't detect it. So seeing something where we don't have, if the evidence shows that it's okay to do, we should do it. I'm glad to see that people
anything that knocks down that pre-existing fear and stigma that still exists within our own community, to be fair, is a win for us. And we often talk about celebrating small wins here, so we should take this as that.
I only hope that HHS survives RFK Jr. And that the NIH will still exist after Trump takes office. So let's just hope that's the way it goes.
That is a big LGBTQ story for today. There is no other LGBTQ nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.